David, a lot there. What stood out to you?
Yeah, well, let's just run through the highlights. There was a lot there. First, on the small business front, in response to some concerns that some small businesses we're not enough small businesses were getting the support they need. The emergency loan program has been expanded and enhanced, and the key metric there is how you can qualify. So if you're a small business that had a payroll in 2019 of anywhere between $20,000 and $1.5 million, you are now eligible for an emergency loan. And you get that loan, by the way, through your financial institution. So call up your bank and let them know that you're looking for a loan. They'll have some information for you. The second thing is the government announcing a new program. This is a new program called the Canada Emergency Rent Program, Relief Program. It's all about commercial rent. So this is businesses who've been saying, listen, I can't make the rent on my store or my factory, whatever it might be. The federal government is going to help to provide rent coverage for April, May, and June. Details of that program, TBD, as the Prime Minister is saying. Rental relations are really a matter of provincial responsibility, and so that's what's going to happen once the Prime Minister speaks with the provinces. Speaking of which, that meeting, a teleconference, the First Ministers will have a discussion by phone this evening, and they're going to talk about that rental program, but also the other big public health emergency right now is the safety of seniors in long-term care facilities and in retirement homes. Quebec, we've just learned, has made a formal request to the federal government for some help, emergency help. That may be in the form of Canadian Forces personnel, it could be Canadian Red Cross workers, and it could be some volunteers that have registered at a Health Canada site. The Prime Minister is saying he couldn't provide any details about the help Quebec is going to get. It's going to get some help, he said, but they're still trying to figure out exactly how that help is going to come. For the rest of the country, who is also worried about long-term care facilities, that's really where the crisis is. One of the things the federal government is being asked for is some money to help top up the wages of workers in long-term care facilities. I'm certain you're going to hear that's what the premiers are going to talk about tonight as well. We also heard one last thing, Anthony, about that border with the United States. We do know, we were talking about this just before the special, that President Trump, is, quote, ready to talk about easing border restrictions between Canada and the U.S. The Prime Minister's point today is we're a long way, I think that was his phrase, a long way from significant easing of any restrictions on the Canada-U.S. border. So quite a bit in that press conference on business, on help for long-term care facilities, and on the border.
Yeah, and you mentioned the public health emergency with long-term care homes. He says that more needs to be done to protect the vulnerable seniors in this country. And, a lot more will come, of course, out of the call tonight. A lot of people say that this should have come a long time ago in terms of boosting the wages for these incredibly hard workers working at long-term care homes. I mean, you look across, in Quebec, for example, 150 long-term care homes in that province affected by the outbreak. 15,000 cases in that province. Obviously, that, among so many others, need the help. But when could that help come? Not just for the employees, because that's one thing, but also real measures for these long-term care homes that desperately need the help.
Yeah, as we've heard, and this is one of those things where, really the provinces, of course, are the key actor here when it comes to long-term care facilities. All these facilities are licensed by provinces, the regulations are set by provinces, and so on. And the provinces know that, and they've been talking about that. And so far as we've been able to hear from Premiers Ford in Ontario, Legault in Quebec, the problem right now is not so much about rules and rule-making. We did hear the Prime Minister talk about some potential movement on that. The problem is a manpower problem, a nurse power problem. Doug Ford talking about we need more firefighters. That's the metaphor he uses to put out the wildfire in nursing homes. So this is a problem of manpower, and even if you up the wages of the existing workers, you're still going to be with a problem. You just don't have enough people who are trained. So right now the call is out for personal support workers, registered nurses, all sorts of nurses. Are you in retirement? There was some news this morning in Quebec that about 1,000 doctors who work in other areas are putting their hands up and saying, right, they're doctors and ready to go to work basically as nurses in long-term care facilities. So it's a manpower issue, and that's really at the heart of Quebec's request to the federal government, is just needing more bodies who can be either trained quickly or already have some skills to take care of people who can't take care of themselves right now.
It is a massive mobilization underway. Obviously, help is needed. David, we'll leave it there. Thank you so much. And let's stay in Ottawa and bring in our Ottawa Bureau Chief, Mercedes Stephenson. And we touched on that with David, Mercedes, the help that is being requested by Quebec, the third time, in fact. This time, and even the Prime Minister acknowledged this is a unique situation because they're asking for help for long-term care homes. Elaborate on what that would mean and what role the military could play, and really whether the military has enough resources to address the problem.
Yeah, and those are all great questions, Anthony, and I think we don't know the answers to a lot of them yet. And the Prime Minister alluded to the fact that they don't even know how this would work. They're looking at different scenarios. I talked to a very senior source in the military last night because we'd been hearing rumblings about this possibility, and they were saying at that time they had not seen a request, this particular person, but that they weren't really sure how this would work either. Now, the military has a lot of capabilities. Most of them relate to things like transport and logistics. So they might be able to help, for example, in the healthcare system, like they are up north right now with the Rangers, providing tents, helping people line up, helping register people. It's a whole other ballgame if you start bringing them in to care for people in long-term care homes. So what are the options for what that could look like? Well, that's a great question, and I have a feeling that military planners are getting creative right now to try to figure out how they support that. Does it mean that there's certain basic roles they could take care of that wouldn't be medical? So could they perhaps worry about things like delivering the meals or making the meals, disposing of the waste? Is this talking about bringing in medical care? Because you heard the Prime Minister say, you know, that there's a limited number of people in the armed forces who are doctors. This is not like the U.S. military where there's a huge number of doctors and nurses who could be deployed. We do have them in the Canadian Armed Forces, but not in the kind of numbers where they could all go into these sort of long-term care homes and start providing service. But it's not necessarily doctors and nurses that are needed either there. It's that care and support. It's making sure that people get their bed sheets cleaned, making sure that they are receiving hygiene, that they're being fed, that their medications are delivered. And there are troops who perhaps could help with things like that. So they have to figure out how to do this. The good news is, Anthony, they have some people who are ready to go if they don't need medical experts. And that is 2 ship's crews who have just finished 2 weeks of being in complete isolation in hotels. They were being put out to sea to sit on ships to make sure they don't come into contact with anyone. So that is one option the military would have of people who they're sure would not bring COVID-19 into those homes. Whether or not they're going to use those Navy ships crews, we'll have to wait and see. They might use local reservists. They might use the military in Quebec. As you know, there's a very large base up CFB Valcartier in Quebec City. So this is an unprecedented request, and they're trying to figure out how they can make it work. The military will have to say what they can and can't do, and then the federal government can respond to Quebec's request from there.
Well, if there's any organization, and I use that term, you know, in a general sense, that is more prepared for humanitarian missions like that, as we've seen them do across, you know, in many countries around the world, it is the Canadian military, isn't it?
Well, they're certainly experts at adapting very quickly to situations. I mean, typically what they would be more used to doing would be something like a field hospital. And I know they have contingency plans for that, that if this pandemic overloaded hospitals, they would take over, for example, big conference centers and turn them into hospitals. But they can adapt. They will be trying to figure out how to best potentially do this. I know that in all of the provincial meetings, and we've talked about this before, there are Canadian Forces planners sitting there. So they have a pretty good sense of what the provinces might ask for, and they're sort of giving feedback on what could be involved. There's all kinds of plans called contingency plans that the military always has for essentially every possible scenario. And given what we've seen with long-term care homes, I cannot imagine that people in the military did not see that and start to think about what happens if we get an ask there. So it'll be very interesting to see what they come up with.
And we didn't hear too much about this next topic that I'm going to mention, the mental health issue in this country. And many health officials, you know, have been calling, you know, he mentioned this yesterday, a new portal, online help. But health officials across the country have been, you know, demanding help and calling this the echo pandemic that is about to emerge. Is there any sense that where this is going to go? Because yes, there's a new initiative, but the problem seems to be getting bigger by the day, doesn't it?
Yeah, I think it gets tougher and tougher. People are, very resilient and doing their best. But in particular, you have families that are in a very small space together, parents who are trying to work and look after their kids. You have people who can't see elderly parents who are ill. You can't see your friends. You can't see your colleagues. We're not used to that kind of social isolation as humans. And even though we have the technology to connect, it's not the same as seeing people in person. And that can be very, very hard, especially for people who have anxiety and depression. And we know that there's been a spike in the number of domestic violence calls. There's concerns about the impact on people's mental health that isn't seen and isn't resulting in a police call and therefore not measurable. So the federal government announced this portal, but the question is sort of, how many staff are they going to have operating it? How easily are you going to be able to access this? And we don't have answers on all of that just yet. There's certainly a demand and a need out there for people to be able to access mental health supports. And the longer this goes on, the longer people are isolated. You layer on top of that, it is a pandemic and people are worried about their health, and many are worried about their financial security and their jobs. So certainly a very tough time, and everyone's being told to hang in there. But it's also a time where people should make sure that there are ways to reach out for support and to do that if they feel that they need it.
Yeah, and the longer this goes on, the more difficult it becomes. Mercedes, thank you so much. Mercedes Stephenson joining us from Ottawa. And speaking of the mental health issue, just yesterday, Premier Kenny in Alberta announced $53 million for that province in terms of more resources to really help with this growing problem in that province. And let's go to Calgary. Heather Yourex-West is joining us once again. Heather, let's touch on that a little bit too. And connected to all this, the mental health issue connected to the economic issue. And specifically the oil and gas industry have been asking for a bailout, asking for help. We didn't hear anything on that today.
Yeah, you talk about the mental health. We have to remember that people in this oil and gas industry are coming off of another very significant downturn. There are a lot of people that never got back to work, that never fully recovered from the last downturn. I've spoken to people that declared bankruptcy a number of years ago, were just maybe starting to make ends meet again, and then this has happened. So the toll that's having across people's mental health is really significant. We've been waiting to hear about a federal bailout for a number of weeks right now. I think daily we're harping on the fact that the finance minister mentioned it was 3 weeks ago that details about this federal bailout for the oil and gas sector were hours, if not days away. Well, we're 3 weeks now and counting. The sector is getting very anxious. The people that work in the sector are getting very anxious. A lot of small and medium-sized oil service companies say that they really, really need access to liquidity at this point to really keep themselves afloat. We had the promising news from OPEC earlier this week, but we're seeing the price of Western Canadian Select, which is the Alberta benchmark price for oil, dipped below $5 a barrel again yesterday. So that really isn't bringing oil prices up. It's not expected to. Supply is still greatly outpacing demand, and we are running the risk of filling up all of the storage tanks across North America. And if that happens, that's where we could get to a situation where we are facing negative oil prices for Alberta oil, which could just be further damage to the Alberta economy, more damage to people's mental states right now. So, the anxiety is quite palpable here in Alberta.
All right, give us a sense of the negative oil prices. This is something we've been hearing a lot of, and the price obviously not good in many ways. What's the projection?
Yeah, it's hard to wrap your head around how we could get into negative oil prices, but this is because, we can, the oil sands can ramp down production, but they can't stop production completely. They need to keep some level of production going for safety reasons, just to kind of protect the infrastructure. And so because of that, we will still continue to see some production happening from Alberta. And if we're at a point where it's just not going anywhere, it needs to be dumped, well, we need to pay somebody to take that away. So that's the situation where we could be facing negative oil prices for what is a crown resource here in Alberta.
Now, Heather, we don't have a lot of time, but we're hearing in the neighboring provinces, British Columbia, especially in Saskatchewan as well, at least looking ahead to reopening the economy, easing the restrictions there. Are we hearing the same thing in Alberta?
We're not hearing about reopening anything specifically yet. That would come in the days and weeks ahead. But obviously, the Premier Kenney is very anxious to start looking at that. He says that as soon as it's safe, we will start looking at those measures. But right now, it is just too soon.
Yeah, that's the battle between the desire and the reality of the situation. Heather, thank you so much. Heather Yourex-West joining us from Calgary. Now, if you're just joining us, a quick look at what we heard from Ottawa today. The Prime Minister says Canada is contributing to international efforts to develop a vaccine, saying Canada needs to help vulnerable nations coping with the virus. He also announced the creation of the Canada Emergency Commercial Rent Assistance Program. This program aimed at helping small business owners with rent for April, May, and June, something they've been asking for, certainly. The federal government is well relaxing the requirements for the interest-free loans being offered to small businesses, also mentioning that 195,000 loans already have been approved. That works out to about $7.5 billion worth of credit. The Prime Minister will speak with the premiers tonight about better ways to help those in Canada's long-term care homes, saying the federal government received a formal request as well from Quebec to help in that province. Now, you can find full details on globalnews.ca tonight on Global National. I'm Anthony Robart. Thank you so much for watching.